Does this go big for you guys?
Mm-hmm.
Okay.
Mm-hmm.
Mm-hmm.
So I'll just mute it and let it keep running through if we just want to point stuff out that way.
Sounds good.
Okay. So you can clearly see she's not lifting up her foot when she walks. Like she can scuff. There's no like definite heel strike.
Right. I was gonna say there's also like increased plantar flexion, and she's having a hard time clearing her toes.
Mm-hmm.
Yeah.
And then because of that, she's doing she's increased hip flexion on that right.
Mm-hmm.
And then I think with her cane being on the wrong side, she's like leaning over it towards the right a little bit more than she should.
Mm-hmm. It's almost like a Trendelenburg too, I think, possibly
Mm-hmm.
on that right.
Yeah, her gait overall, she just kind of looks like guarded and just it's just not a natural like pace that she's walking at. It's just Dr. East terms wonky.
Wonky.
She also doesn't really have an arm swing. I mean, she kind of does, but I feel like it's more to just propel that leg than like a comfortable arm swing.
Mm-hmm.
It's not a natural.
Yeah.
And
Yeah.
do you think the cane's short too? Because she's kind of leaning forward, or maybe it's too tall.
I think it's a little, I don't know.
I think it's taller,
Yeah.
but sometimes you make it taller if they tend to like lean down,
Yeah,
just to get them to like straighten up.
Yeah, she definitely has an increased kyphosis too in her thoracic.
Mm.
So
Overall, it's just
I
slow.
agree.
yeah.
So I'll pull up the other video.
So do we have to recommend, or is that after the video?
It's after.
So
Okay.
I go to the other one.
Mm-hmm. I think it's after, right? When we gotta type it up.
Mm-hmm.
Do we need to talk about why we think she presents the way she does, or like what's causing those, or do we type that stuff too?
Well, we kind of talked a little bit, I guess. I guess we should have talked a little bit more. I think we can talk on this one though too.
Okay.
So she has an AFO, I'm pretty sure here,
Yes.
but
A little bit more of a heel
Yeah, she's got a increased like stance phase on her left leg. It like almost looks like she doesn't want to put weight through her foot with the AFO.
Yeah.
Yep.
it honestly looks like she's limping more now. Which
Yeah.
is what you were saying, but
Mhm.
I mean, she's able to clear her toes, which is less of a fall risk.
Right.
I still don't get why that cane's on that side, but
I think she still has a little bit of a Trendelenburg in here, so like a weak glute med on that right.
yeah, you can definitely see it drop.
Yeah.
Do you guys feel like she's also slowing down more with the orthotic on?
Yeah.
Like
Do you think
Lauren said,
it's
notice that
new?
she's limping.
Yeah.
Maybe she's not used to it.
Yeah, because she still has increased hip flexion with it. If you look on the right compared to the left, so it might be because she's not used to the orthotic. So she's just used to bringing up that
Yep.
leg there.
Yeah, she's definitely trying to clear the foot, and she doesn't have to anymore.
Mhm.
She didn't have great heel strike at all on the first one, so this is a little bit better. I think she
Yeah.
still doesn't make a good like heel strike into gait, but
Yeah, but she does that with her left foot too. She doesn't really have a heel strike.
yeah, so it's her normal.
Yeah.
Okay. Anything else anyone would like to comment?
She's kind of waddling side to side, but that could be the Trendelenburg type gait that she's got going on. But
She
Yeah.
almost has almost like, I guess, almost kind of like a shuffle pattern, kind of, but not fully. But kind of like how you guys were saying that she doesn't want to like really pick up the foot.
I was trying to watch her stride length, and it looked like she may have taken longer strides on the left. Kind of hard to tell, but like at times, like the clearance, like the space between like the toe and heel with her steps, just looks like she's taking a longer stride on that left side.
I think it was a good choice though for her, orthotic wise. After looking at the before picture, I think it just takes time to get used to.
Right,
Yeah.
because you can see improvement already,
Yeah.
especially with the toe clearance.
I think she's just got to get used to that, and she doesn't have to lift her hip up as much. Technically, I mean, her foot's not clearing very high, but you can tell a difference for sure between her like unaffected leg.
Let's do some gait training, bill her for gait training.
Because initially she made me nervous because I thought she would stumble over her toes.
We can go back to that one too if we need to look. Any other comments? Okay. What else do we need to discuss about her?
I mean, as far as her knees go, I don't really, it's kind of hard to like tell, but it doesn't look, I feel like we've talked about everything else but the knees, but they look like they're okay.
Yeah. 2 gait deviations. We kind of talked about them, but then how would we correct them?
I think she definitely needs glute strengthening exercises. So,
Yeah, glute med.
yeah,
Gonna
whether it be like monster walks or like walking backwards or
You can do like side steps, hip abduction, standing hip abduction for glute med.
yeah, and she's got like no hip extension either.
Yeah. She doesn't really have a lot of torso rotation either. Like she kind of just walks just like straight forward.
I'd also put her can on the other side and do some gait training.
providing her with like verbal cues of some sort to remind her to swing her arms more. Like I think at first with patients when they're walking so like guarded kind of or without arm swinging, you kind of have to overemphasize it and provide them with those verbal cues. But
And she could also improve on her posture too.
Yeah. Orthotic based, we already know what orthotic she got, which is an AFO. It looked solid. And do you guys think that was the appropriate orthotic for her?
Yeah. I think that kind of like what we were saying, if she just had like some gait training and stuff and doing the different like Therax interventions, that I feel like her gait would improve for sure.
Yeah, I would agree. I'd say at this point she needs more strengthening than anything.
So you guys think it's due to weakness?
Yeah, I mean, do you think she had a diagnosis? Like, are you guys, I don't see something specific.
There isn't a diagnosis that's jumping out from her presentation.
Yeah, she just seems like just needs some strengthening overall. Maybe just like deconditioned with age, but
Well, there's definitely something that's going on with that foot drop. So I just wonder why she
has it.
is it due to like something like neuro-wise, or is it musculature? So if it's musculature, then we could try and strengthen the tib anterior.
Mm-hmm.
But if it's neuro, there's,
Yeah. I mean, she could have had a very small stroke too.
I was gonna say
Yeah.
it's common to get that with stroke,
yeah.
but regardless, I think the exercise will help.
Mhm.
Mhm.
Alrighty. Any more comments on this lady?
Move the assistive device to the other side.
Yeah, that's the big one. Okay, I'm gonna stop sharing and then pull up the other one. And stop recording.